As we mentioned earlier, women's representation is still low at every single stage of research and development. For example, pregnant and lactating women are often excluded out of clinical trials, which means that there's an obvious gap in healthcare delivery and the services that they get. How do you think we can address this kind of inequality?
Yes, clinical trials must consider better the heterogeneity among women, and they need to be more adapted to women. And for the case of pregnant people, we've seen over the years many studies show how the immune response in pregnant women, so their capacity to adapt and to protect themselves against diseases, or all these defenses are lower in pregnant women because they need to keep their baby and not attack them, right? So it's really important for them to have a lower immune response so that they don't attack the baby, but at the same time, they are more vulnerable to infectious diseases. So we really need to find a treatment, vaccines that will be more adapted to them. And at the same time, their unborn baby they're more vulnerable to infectious disease once they are born. We know that their immune response is lower than adult, they're more fragile. And if we vaccinate women while they're pregnant, they will have an activation of their immune response, which is going to be also beneficial for the babies. So all the more reasons to find treatments and specific vaccines that will be beneficial not only for the pregnant women, but also their babies. And the issue is that instead of including them more in clinical trials, they tend to be excluded to protect them. But what needs to be done is really to adapt the therapeutic approaches that we have today that will take into account their vulnerability in order to protect them better and also protect their kids. And talking about clinical trials in general, what we see today is that clinical trials will try to have as many, they will be well balanced in terms of gender. They will have as many women as they have men. They will be balanced in terms of age, origins, and so on. But the big issue is that they don't take into account the heterogeneity among women. It's not enough to just take the same age of women and men. We need to also focus more within women because a small variability in age among men doesn't have so much impact, but in women it does because of their weight, their hormone levels, because of the fact that they will get closer to menopause. So it's really important to understand the mechanisms happening in women, take into account the heterogeneity in that population, so that we will eventually have therapeutic approaches that will be better adapted to them. Also for the women who want to have kids, it will be better adapted to the kids as well, in order eventually to have a more personalized medicine that will protect women and also their kids if they want to have kids.
Thank you so much. Thank you so much, Nadej, with a very pertinent point. It's not only about representation, but it's just logical. Like you said, the heterogeneity.
Exactly.
Thank you so much. With the pandemic and everything that's been going on, it became so glaring that countries really need to invest in developing the capacity for vaccines, diagnostics, therapeutics. A critical step in this being able to happen is to develop the necessary human capacity, the necessary human potential, as well as attracting the financial and technical investment. According to you, how can this be achieved, and with a special focus on engaging women in this field of biotechnology and biomanufacturing?
Thank you. Thank you very much to the Women Deliver Conference for inviting me. Really happy to be here to talk about this topic, which it's a topic that I really, really love, based on my different years in manufacturing and how I've seen women involvement really, really grow. Clearly, when we come to the manufacturing space, one of the things that impact manufacturing as a whole, for even the company to be here to try to look for people to build, is the ease of doing business. So each country needs to create that environment. For a company like BioNTech, we've been happy that even in Rwanda here, we've been giving that environment whereby the ease of doing business has been great. And so when the ease of doing business is there, then people are willing to invest and create that opportunity for people. Now the next point is that when that opportunity comes, you want to focus on women you also want that women are available for those opportunities. And it comes by encouraging the change of the constant norms. Because in manufacturing, people first think about what? Engineers. And in the old adage, when they think of engineers, they think of a male-dominated field. But this has changed over time. So the first point is to actually drive that encouragement that it's a level playing field, which the country and the industry is, driving, but it has to be deliberate. So my first word is that actions have to be deliberate, because even when you're looking for people, you have to be deliberate that this role, I can hire a woman for this role. Currently in Biotech, we've been able to look at have diversity as our key goal, and globally our diversity is, the percentage of women is above 50%, and currently even in Rwanda, the percentage of women in the workforce is 50%. We have not looked at different roles. I felt there's a role meant for a man and there's a role meant for a woman. So now that we're here, we look at a role whereby people can qualify for that role. We have women as construction managers. We have women as facility managers. And this drives the encouragement that any young female engineer in the university can see that and know that there's a role for me to play. We have women doing several research works across Biotech. So the first thing that the company needs to have that diversity goal to make sure that it's a level playing field. And another deliberate action is to create a women network. I have worked in different companies and where we have the women network, whereby women can be mentored by senior managers, by other women that have been successful in the industry. And this drives more women involvement. This gives them the fact that they've stepped foot into the door as an engineer, as someone in manufacturing, and they can pursue their career to greater heights because they can see examples, they are being encouraged, and they are being coached. So this is key to be able to continue to drive the business and ensure that there's women involvement in manufacturing.
Thank you so much. Thank you so much for your insights. We have evidence that there are conditions that the conditions that affect women more than men tend to garner less funding, which undoubtedly has an effect on research. What kind of initiatives can funding entities that support research and development implement to really foster the prioritization of gender-responsive research and product development?
Thank you so much for having me on this panel. Excuse me, I'm just getting over a cold. So, it's so nice to be with my other colleagues here. So in terms of what funders can do, I think at its core, we need to start by looking at the public health need that's out there for women's health. And I won't repeat what others have said, but if you just look at a few statistics, like 200 million women needing access to contraception, 25 million unsafe abortions. In sub-Saharan Africa today, still a 15-year-old has a 1 in 40 chance of dying from a pregnancy-related cause. And I won't repeat other conditions in which disproportionately affect women, not to mention women's physiology, right, that responds differently to medications. So for philanthropic partners, which is where I sit, and development partners, investing in women's health products is a no-brainer if you just look at some of those statistics and the need that's out there for these products. In addition, you add on top of that the benefits that we all know of improving women's health and its effect on economic development and growth and the health of societies as well. It's, as I said, a no-brainer. Of course, the private sector has other incentives as well. But I think even there, we can think about women's health products as an untapped market opportunity as well because there's so much unmet need. I think one of the challenges that comes up there is that there's not always visibility into those market opportunities. So there's actually a good opportunity for philanthropic partners to partner with the private sector and look at ways they can do market intelligence, market shaping, de-risking, and other market interventions to help create the incentives for the private sector to invest more heavily. So that's really more on the what funders can fund, but I think also, to your point, it's also about who we fund. And I think there's no doubt that one of the root causes of why women's health products, as Her Excellency the First Lady was pointing out so clearly, one of the root causes of why there aren't women's health products is that there aren't women decision makers in the rooms. So when funders look at what to fund, it's also selecting companies that are prioritizing women in their policies, companies that have those diversity, objectives, and also funding the pipeline of talent that's actually needed. So it's not just the what we fund, but also the who we fund, and really being specific to say we need to have women in those decision-making positions.
Dr. Sabin, the role of government in, as Aneto said earlier, the role of government in fostering the right environment for biotechnology and biopharmaceutical research can't be understated. In Rwanda, this industry is still in its inception, in its beginning stages, and it offers a unique opportunity to be inclusive right from the beginning. Where other people have had to reach back and change their systems, we have the opportunity to make it how we want it from the beginning. How can we leverage this opportunity to drive more equitable health outcomes for women?
Great. Thank you, Anik. Good morning, everyone. Your Excellency, the First Lady, I think after your inspiring speech, what I had to say about what women can do in science, what we all can do changing our policies, and how we create environment for research and manufacturing for women and even men, is clearly that it starts with leadership. And what we do as leaders in different places. So the question Nick highlighted is creating this environment is not something you do overnight, and you can't take shortcuts to do that. So it has really to start from even the kindergarten, where you teach kids how carbon fixes on oxygen to form CO2, and how really you get water, what it means from the basic science. And this has to be the first thing to do from education perspective, up to the other levels of teaching. Unfortunately, we're seeing across different countries, women and young girls joining schools from early years, primary, secondary schools in science. But as you go up, there's a kind of lost to follow-up of more men continuing and women and girls stopping at some extent, which at the end is a product you're seeing that a few women into top science or discoveries because of different factors. Some are related to the legacy of many things that there are things that women cannot do, including science, including engineering, as you highlighted. But things are changing. We have a biomedical engineer on this panel already, but it's not enough. What we need to do is actually to create or to remove those barriers that are stopping these fast runners to reach the levels we need. Like you've seen in recent pandemic, women were at the forefront of discovering the most efficacious vaccines, including Biotech itself, with my colleague here has already highlighted one of the discoverers of BioNTech Pfizer vaccine was a woman who is currently also doing a lot of interesting research. We are also seeing the same with other Moderna vaccine. You all know the doctor behind who has also contributed to that. And I'm sure and confident that maybe the next vaccine is going to come from one of the women's in this room or beyond, or behind this room, probably on this panel, Nadej or Anik. So these are the things that we are very happy to see happening from the journey of education, But beyond education, there are also other enablers that we need to put in place as policymakers, as scientists, as leaders. And the most important one is also infrastructure. The laboratories that we put in place, research centers, even research clubs, networks you talked about. These are the things that need to be done now so that we see results in the coming years. There's no shortcut. And also the leadership that creates that environment. There's evidence that countries that are most successful in economies are those who invest in science, innovation, research, and at the end you see actually these are driving economies heavily. There's facts about that. And sometimes we may stop at the point and say, okay, we are not seeing result immediately, and so we're not going to continue doing that. So in science, the thing you see by manufacturing, from microscope through manufacturing to human body, it takes time. It can even take hundreds of years. But the cost to not doing it is very, very high. So starting now, it's important, and having that patience to see that it's evolving, it's happening, is also critical. So those are the environments we need to put in place. But the other aspect is a culture. The culture of how, even if the policies are there, the enabling factors are there, how do we, from this legacy we had where women are staying home, cleaning houses, not going to school, changing into now more women in schools, like the case of Rwanda that you highlighted, how do we do more of that? And understanding, even if you go to school, you can do maths, you can do physics, you can be an engineer, you can be a scientist like Nadej, you can go to the highest levels of spending nights and days in the lab without being compromised because you're a woman, because you're a young girl. So those are the factors we need really, really to put in place, as everyone has a role to play. But from the cultural aspects is also as important as the policies and books we put in place. Number two is what do we do with the science that women contribute to? We're seeing many diseases affecting men and women differently. Let me take two examples, like cervical cancer. It's a disease. It's actually an important one that is affecting many, many women and girls currently. As we plan to eliminate cervical cancer among women and girls, it shouldn't be an issue of women and girls. It should be an issue of all of us. And should be the same as we work together to also address the issue of prostate cancer, which is another men specific issue. But what affects women affects men equally, and addressing it has to be a collective effort. So maybe to cut this story short, I want to highlight two inequities that we need to address jointly. There's a gender issue that I just highlighted, but there's also regional issues in terms of science and research. And using two statistics, if you look at the research output that, let's say, our continent contributes to the world, it's only 2%. And the spending on research and science from our continent is 1.3%. And the level of patent that we register as a continent is 0.1%. So this is an example of regional inequity that we have to address, equally as we address the gender inequity. Now, being a woman in African continent or another resource-limited continent can be a double burden. So addressing this, need also to look at the regional gaps and inequities that we are talking about and move forward into actions. If we need to see results in the next 10 years, we have to plant the seeds today. Thank you.
Thank you very much for this insight. Just some follow-ups on the questions you've been asked. I think my first one will be for Dr. Nadej. As someone who has been in research for as long as you have been, and who's reached the top levels of what research can be. What do you think for people who might want to have a parcours that's similar to yours? What were your biggest enablers that allowed you to go as far as you've gone with the trajectory that you've had?
So yeah, thank you for your question. If I speak, I mean, as a woman, of course, I'd say that one of the biggest challenges that I've seen is when you decide to go abroad. You know, it's when you're home, you have opportunities, you have people who will like more easily trust you. And when you decide to leave everything, go abroad, and be a foreigner, it can be really challenging. And I spoke to some of the younger girls who try to who are going using the same path as me, and they would say, "Oh, you know me, it's particularly difficult because I have this and this issue," and I would keep telling them how we are all facing the same issues. It's always difficult, and the key is you go back home, I don't know, you scream, you cry, you do whatever you want, and then the next day you come and you try again, and it's all about. It's all about continuing. The only time when you see, the real failure is when you just stop trying. So it's all about continuing, going again and again, always trying to have network. So we talked about it earlier, as you mentioned, having networks, like having group of people, women and men who have been through what you've been through, and then exchanging, sharing your experience, and then you realize that you're not the only one who have gone through all these difficulties. And this is so helpful, realizing I'm not the only one, they did it, so I can do it as well. So it's really the believing that you can get there and then keep going, and then you will keep failing. Like again, this year I had a failure, and it was surprising because I thought you think you get to a certain point, it will be easier. It's not. So you go back home, again, you cry, you scream, you do whatever you want, and you come back the next day, and you keep trying. It's all about network, as keeping in touch with people. That has helped me so much. Directly contacting people, going on LinkedIn. I'm always trying to get better at it, like with Twitter. You know, it's all about the networking, to showing that you are capable of doing, like accomplishing a lot. It's all about believing in yourself and then keep going. And then you will fail, but then just keep going.
Thank you so much. What a rallying cry. The only failure is when you stop trying. That is really something for all of us to keep. So just keeping on the topic of networking, my question is for Aneto. As someone in this space, how can, not just women, we talked about having women's networks in this space, but also how can men in these industries also support women who are trying to break in?
There is a cultural shift happening, and I'll use myself as an example. I mean, like 20 years ago, the way I look at women in the industry now is completely different. So there is a cultural shift that is happening, and like I said, one of the first things is to be deliberate. Sometimes it starts from deliberate actions, then it becomes natural. When I started my career, I was blessed to have lots of women working with me. I was really blessed, and rather than look at it, and it changed me. You have to, as men, you need to leave yourself open to the process, because you also learn, because it changed me. Trust me, it changed me a lot in terms of being perceptive to feelings, understanding the diversity and care that comes. It just balanced the way I managed people. Because women bring a different perspective at times. When you're looking at getting things done, and in the discussion, there's a care aspect that comes into it, you also learn. So first of all, you just have to be open to change. And sometimes companies help people, because by companies being deliberate to talk about it, being deliberate to ask you, even what's your diversity factor, how are you managing this person, how is this person excelling in her career, then you start to be deliberate. You start to break that barrier of coming closer, understanding, and giving them the opportunity. And once you let that door open and you see the way people's career flourish, then you become a changed person and a very balanced person. I really am very proud to say that I've worked with so many women that has really made me who I am today. You know, I became surprised, when women would tell you part of their pains, and you're wondering, why are they telling me? And you're able to help them out. And I think the most impact that came to me was when a direct report really came out as a wow factor to say, hey, you helped me through this. So as people in the industry, you have to be open to change. The industry has changed. I need to keep changing. There are more women leaders. There are more women in engineering. When I started in manufacturing, on the operations floor was male dominated. There was one changing room. As the years have gone by, it has changed. There are two changing rooms. There are more females on the floor. Operation managers are women. They are managing men. So things have changed. So first of all, openness. You have to be open to change because the times are changing and we need to ride with it.
My next question is to Liz. You mentioned what gets funded and who. As funding entities, when you're looking at who to fund, it's not just looking at whether they have women in their C-suite. What other factors are you looking out for when you're looking for initiatives that you want to support, but you want to make sure that this is truly doing the good that they say it's going to do?
Of course, it's not just women in the C-suite, right? I mean, we need women at every level, and to what Minister Sabin was saying, we need to start at the very young ages. So I think from a funder's perspective, there's really ample opportunity for funders of all different priorities to be involved in this work, whether you're someone who is funding early childhood education, right? How do we build STEM focused early childhood education for primary schools and high schools? If you're someone who's focused more on the manufacturing side, you can be looking more at who's in what is the makeup of the company, right? And actually looking at how are they prioritizing women. And of course, I think you need to look at not just what's written on paper, right? Because every organization has a statement that says they're committed, but the proof is really in who's sitting in the decision maker roles, who's in the offices, who's actually on the manufacturing floor, as you're saying. So I think there's a tremendous amount of opportunities for different funders to be involved at all levels. I think the one caveat from a funder standpoint that I think is worth putting out here is that funders are not great everyone likes to do their own small thing. And I think what's so important in terms of building biomanufacturing capacity and this pipeline of talent is really that funders are following the lead of those who are actually setting out the strategy. So in the case of the government of Rwanda, right, and funders are actually backing the strategies that are laid out, because we can't have, if we really want to create this fundamental shift and create more women's health products and create a broader pipeline of women doing this work, it can't be small pieces here and there. It has to be backing a comprehensive plan to really make this happen. So that would be my encouragement to funders who are in the room.
Thank you very much. And my final question is for Dr. Sabin. You mentioned the need to have all these positive reinforcements and positive images for young girls who are interested in science. In the case of Rwanda, where we've seen success stories while dealing with women's health issues, how can we as a community, because education is not only about school, how can we as a community, Rwandan and at large, ensure that children get those positive reinforcements? What can we do on our side to make sure that they see these stories, to make sure that they know about these women inventors who are working on the vaccines that helped us at such a critical time? How can we really make sure they get those positive reinforcements, not just at school, but in their day-to-day lives?
Great. I think there are 3 points that I can highlight here. One is that we've moved from an era of doing things using muscles and physical forces to implement things. Like driving machines, pushing whatever, construction, carrying things. Now we are in an era of using our brains, our thinking, our innovations, our patience to do the same things, even more of what we were doing before. And that is changing what you've observing in your career, that it's the technology, this science of today, it's not a man's thing. And that has been actually rooting into back in the culture, in the history, that men were actually seeing themselves doing things while women and girls staying behind for things that are not requiring that energy, or because there are no rights to participate or contribute. We have to enforce that message that things have changed, even if there are men who are still believing in that historical thinking. It's time to wake up and move into modern world where men and women have equal rights, have equal opportunities, and they can drive and change things, including the highest level of science that will change our world for the better. That's number two. Number three is how practically do we do that? It shouldn't be men telling women, go, come and do that. It should be also women telling men, look, we can do this with you. It's not about women doing it, then men going back in the where it was before. It's actually joint work that will help us to see more discoveries, more vaccines, more women into engineering, into basic science, and other fields. So I see changes happening, but my worry is that it's not at the speed it should be. We're seeing still restricted areas where actually women could do even better. And when you talk about science, you talk about patience, you talk about curiosity, you talk about thinking and innovating something new. And naturally, I think women are better in those kind of steps I'm talking about than men. They are more patient, they are more curious, they are more innovative, they can multitask and find solutions better than men. So I see actually women driving the future of science than men, but as we see that change happening, we should not say that men should stay behind. So we have to keep our family connections, because at the end, every man has been on this earth because there was a woman who helped him to be here. So we all belong to one community, and I see that happening. It's just a matter of mindset changing, policy adaptation changing, and also networking, and make sure we can't accept to live in 100 years back.